my name's Adrian Richards. I'm a plastic and cosmetic surgeon. I'm the surgical director of Aurora Clinics. So today I'm going to be talking about what to expect really following Botox treatment for hyperhidrosis. So I've talked in previous videos about how the treatment's performed and who's suitable and alternative treatments. And if you have had Botox treatment to the armpit, it involves multiple small injections, normally about 20 small injections in the armpit. And the area will feel a little bit bruised following treatment, but really you should be able to do most normal activities later on that day. Interestingly, a number of my patients have mentioned that the sweating, they've noticed a reduction really very quickly within hours, which is slightly unusual because Botox typically works over 4 or 5 days following treatment, and you certainly should have noticed some reduction in sweating by a week following the treatment. So by a week, you may not need to use deodorants anymore. Certainly the sweating should have decreased. If there is some residual sweating during that time, carry on with your normal deodorants during that period. So Botox works by blocking the nerve impulses to the sweat glands, and after 2 weeks, the Botox effect will have taken its absolute maximum, so you won't get any more improvement following that. So what we like to do is, if you still have some residual sweating at 2 weeks, we'd like to get you back. If necessary, we can perform a starch iodine test to really assess which areas are still sweating, and if necessary we can just give you a little extra treatment to that area which may not have been fully covered within the first treatment. So after 2 weeks you should be essentially sweat-free. You can use deodorants if you want after that, but many of our patients find they don't need to use any form of deodorant or antiperspirants during the time the treatment's working. Treatment normally lasts about 6 months. It can actually last more or slightly less, but 6 months is about an average, and then you'll notice a slight decrease in the sweating, and the sweating actually can come back over a sort of 2-week period, to the extent that it was before. So what we do normally is ask patients to contact us when they notice the sweating return. If you absolutely wanted to be absolutely sure that the sweating would never return, you could book another appointment after your initial one 6 months later, and we could repeat the treatment. And that will, if you had it every 6 months, that would ensure that you never really sort of sweat in the long term. But alternatively, just wait until the sweating starts again, which will probably be slightly over 6 months. People often ask me, is there any danger, following treatment? And you can get some extra sweating from the small of the back, and I'll talk about possible side effects of Botox treatment in another video. So thank you very much for listening to and watching the video. If you'd like any more information about hyperhidrosis treatment, please contact us either via the website or by phoning us on 01844 214 362. Thank you very much.